everyone, welcome back to Midwife Par Excellence. This is your registered midwife, Bernard. Today I will be talking about antenatal care, also known as prenatal care. And this really is a planned program aimed at detecting, treating, and having the best possible outcome for mother and baby. Now, we acknowledge the fact that abnormal situations may present themselves at any given time, and that is why it is very important for you to have your antenatal care. I'll be talking about what to expect in your antenatal visits, the different tests that are done, what they mean, and also giving you some tips on how to prepare for the upcoming baby. All right, so please stay tuned and we'll be learning a lot. Thank you. So, at the very thought of becoming pregnant, you want to start taking your vitamins, namely your folic acid, which helps with the development of the baby's brain and spinal cord. You also want to start taking your iron supplements, which will help you to prevent a condition called anemia, which is a decrease in the oxygen carrying capacity of the blood. Baby will be taking some amount of iron from you, so it means that you have to put it back in your storage. It will also help you to prevent becoming symptomatic in the pregnancy in terms of having all the conditions, weakness, blurred vision, dizziness, and also it helps you in preventing postpartum hemorrhage after you've had your baby. So it is very important that you start taking your vitamins, ladies. All right? Contact your pharmacist, your physician, or your midwife so they can give you the proper directives as to how and when to take it. All right. Once pregnancy has been ascertained, it is very important that at around the 8th to the 12th week of pregnancy, you make an appointment to see your obstetrician gynecologist or your midwife at your nearest health center to your home. You'll be asked to take along your immunization card, the first urine in the morning. If you have not yet initiated your vitamins, some will be provided for you. It is important that you also remember the first day of your last period, or you come with your ultrasound report, and this is helping to determine your estimated date of delivery. All right, please make an appointment at the nearest booking clinic to you, whether it's your obstetrician gynecologist or your nearest health center, to see your midwife. Thank you. Persons tend to ask, why do I need to bring an overnight urine? Now, this would have a higher concentration of the things that we're looking for. If there's glucose present in the urine, it means that the mother is not excreting the glucose enough from the body, and it could trigger an investigation to rule out diabetes. If there's protein present, it could mean that there's possible kidney damage or a development of a condition known as preeclampsia, which we'll talk about later. We want to rule out leukocytes. If there's leukocytes in the urine, means there's possible urinary tract infection. If there's blood in the urine any at all, it means that we have to do further investigation. If there's ketones in the urine, the mother could be signifying that she is starved, dehydrated, is having highly stressful conditions, or she could be developing diabetes. So all these things we look for when we do a urinalysis. All right, so it is very important. Your urine is very important each time you attend your antenatal clinic. Your weight will also be monitored at each antenatal visit, and this is to enable your midwife or your obstetrician to determine if you're losing the weight or you're gaining the weight. Now, the ideal weight gain during the pregnancy is around 25 to 30 pounds. However, if you're already deemed to be obese, you will not need to gain more than 15 to 18 pounds during the pregnancy. All right, so ensure your weight is monitored every antenatal visit. All antenatal clients are provided with an antenatal book by their care provider. If it is not your first baby, you would have had a clinic book from the first pregnancy, which is valid to take you for the other pregnancies up until about the fourth pregnancy. So for history taking purpose, it would be very fitting to have that book with you to continue your antenatal care for the other pregnancies to come. Now, the pregnancy book has a lot of information that is very important that you read to take you successfully through your pregnancy. If there is anything that you're querying in the books, you can speak to your healthcare provider on your next clinic visit. All right, so please, ladies, go ahead and read your book. It is very important that you do so. There is pertinent information that you need. On each antenatal visit, you should have learned something new. So your healthcare provider will tell you something new or something that you would have known before, but you are now more enlightened or reminded of such. All right. Please, while you're at home, make your necessary jottings, any questions that you have. So once you are before your healthcare provider, you can remember to ask, and then you will get the answers to your questions that you might have had during the time that you were at home. So ladies, please use your antenatal visit as an enlightening process to carry you through the pregnancy, labor, delivery, and even in your postnatal phase. All right. Your immunization card is very important in helping your healthcare provider determine if you're deficient in a vaccine or if you're fully immunized. Your diphtheria tetanus vaccine, if found to be deficient, will be administered in the pregnancy. However, your measles, mumps, and rubella shot, if found to be deficient, is contraindicated in the pregnancy and will only be administered after you've had your baby. So please ensure that your immunization card or your status is relayed to your healthcare provider. All right. So on your first antenatal visit, a blood test will be done. This is to check on your HIV and your syphilis status. We'll be checking your hemoglobin levels to rule out anemia. We'll be checking your sickle cell status to rule out sickle cell trait or the sickle cell disease. We'll also be checking your blood type, which means if you're A positive, A negative, B positive, B negative, AB positive, or AB negative. All right, and these can positively or negatively affect a woman in her pregnancy. So this status must be ascertained. All right. An ultrasound may also be requested by your healthcare provider if one was not already done. Bear in mind that the ultrasound does not only determine the sex of the baby, it is also used for confirmation of pregnancy. It also determines if there's one fetus or more than one fetus is in the uterus. It is also used to calculate your estimated date of delivery. There's also an anomaly scan that is requested 18 to 24 weeks of pregnancy, and this is a microscopic view of all organs of the baby to determine if there's any abnormalities. All right. There's also determination if their amniotic fluid around the baby is enough or not enough. So please ensure you have your ultrasounds done, and when your anomaly scan is requested, please ensure it is done also. All right. A full head to toe assessment must be done on all mothers for their first antenatal visit, and this is so that we can detect any abnormalities. For example, a mother with big nipples or inverted nipples. It can pose a problem for her in the long run when baby is born, and there will be a challenge for breastfeeding. So at that time, the nurse will look and say, okay, this nipple needs training, and then she can be assisted. So by the time the baby is born, then breastfeeding will not be such of a challenge. All right. And other aspects of the body too, whatever abnormalities detected, it can be remedied before baby is born. All right. So please expect your head to toe assessment. Remember, your confidentiality is with us. All right. Thank you. Bear in mind too that for your antenatal visit, you want to make preparations with your healthcare provider as to your mode of delivery, and also where you will be delivering, whether you're going to be doing a vaginal delivery or a cesarean section, whether you're going to be delivering at hospital or you're going to be doing your home delivery. All right, bear in mind that yes, you can speak with your healthcare provider as to your mode and your place of delivery. A keynote too, I am all for family. So hence, ladies, if your partner is available, please take along your partner to your antenatal visit. He needs to do his blood test also. He needs to be incorporated in the process. He needs to see what you go through on a daily basis, and he needs to be aware of what is taking place. That way they feel involved and they will be more encouraged to be involved in the process. All right. So ladies, take along your gentlemen with you. All right. From 0 to 28 weeks, you will be required to attend your antenatal clinic every 4 weeks. Between 28 weeks and 36 weeks of pregnancy, you will attend your clinic every 2 weeks. And from 36 weeks up until delivery, you will be attending your antenatal clinic every week. All right? Bear in mind that if any at all a high risk condition, which is a condition that presents itself during pregnancy which could cause a problem for mother or baby, you will be referred to a high risk clinic. Now, bear in mind, ladies, that if you are placed on medication for whatever reason or on a diet for whatever condition that you have been diagnosed with, it is best if you take your medication as ordered or do your dieting as best as ordered. All right, for better results and better management. All right. So, ladies, in closing, ensure you're getting enough rest, you're taking your vitamins, you're having your balanced meals daily. Please, no over the counter drugs unless it is prescribed by your healthcare provider. Bear in mind that the ultrasound is not always 100% correct, so it's best that you shop for your unisex colors. Remember, your bag must be packed for 7 months. Assess your working environment to see if you or your baby is at risk, and you speak to your employer about same. Your sexual activities can continue unless told by your doctor to desist. All right? Remember, ladies, pregnancy is a privilege. Enjoy your pregnancy. It is only 9 months. And enjoy your little bundle of joy when it comes.